Welcome to episode 3 of my Revive Pelvic Floor Health Core Rehab, where we're going to dive into our core strength and pelvic floor core back immersion. In this video, we'll discover the secret to lengthening and strengthening our tight pelvic floor muscles. Hi, my name is Annie, and welcome back to my channel, Annie Pilates Physical Therapist. Join me and my friend Sandy on video 3. She's a postpartum as well. She just had her baby 2 years ago, and she's still rebuilding her pelvic floor strength, her core, and overall body. A tight pelvic floor can contribute to symptoms of leaking, limited hip mobility, and pain during sex. And the pelvic floor should be able to lengthen and relax in order to activate and strengthen naturally. If we're only focused on Kegels, which is the tightening and lifting and strengthening, we could be exacerbating symptoms. So I've seen a lot of my patients who just tried Kegels and there's no improvement until I incorporated the core back immersion therapy. That's why when they hear from the doctor, okay, this is my prescription, this is your medication, and then do these Kegels exercises. And guess what? They come to me and they finally found results even in one session. So while some fitness professionals may dismiss the term core as gimmicky, actually core is so important. It's the powerhouse of our body. And it's a combination of not just the abdominal muscles that most people think. It's a combination of our lumbopelvic hip complex, from your lumbar spine, your pelvis, your diaphragm, and your pelvic floor. So that's why taking deep breaths, which is what we learned on video 1, and then video 2, we learned on gravity assisted to help the pelvic floor to be activated with the pelvis elevated on the foam roller. And in this video, we're going to use the ball. When you're seated on the ball, can you feel supported there? And it feels good, right? Balls is like hugging your pelvic floor. So this is one of my biggest secret exercises to lengthen and activate your tight pelvic floor. Because when you're tight in your pelvic floor, it's not just tight, it's also weak. We call that tight weakness. So in this video with the core back immersion therapy, where I utilize Pilates, yoga, and physical therapy fused together, we're going to combine the stretching, strengthening, and relaxation techniques, utilizing the elastic band. So she has a green band, which is a little bit lighter than the blue band. So each colored band has different resistance at 25 percentile after you stretch it out. And that helps your postural muscles too. If you're hunched forward, breastfeeding our babies, or if you're sitting a lot with your job and it causes a lot of tightness and downward pressure of our pelvic floor. So the pelvic floor relaxation is an exercise focused on consciously relaxing the pelvic floor muscles. So you really have to be mindful. So when you do this, it's best to go to a quiet room and do a lot of mindfulness on connecting with our deep diaphragmatic breathing while consciously releasing tension in the pelvic floor. So you really want to make sure you really think about relaxing, lengthening underneath us. So when you're sitting on a ball, it helps activate already, just feeling the pressure there, right? So if you have a prolapse, it's a little bit closer on the ball. And if you have that pain during intimacy, when you open your knees out, it helps stretch those tight pelvic floor. So the hip groin area. So the pelvic floor stretching exercises can help lengthen and release the tight pelvic floor muscles. And guess what? Our hip muscles are connected to our pelvic floor, especially the obturator internus. That's one of the boomerang shape underneath our hip muscles that wraps around until it goes to the sciatic notch of our hip. So it goes underneath like a boomerang and it cradles underneath the pelvic floor. So if you're not opening your hip joint, that causes a lot of pressure, downward pressure further on the web design of our pelvic floor. So the strengthening exercise aim to improve the overall tone and control of the pelvic floor muscles. So when you are very tight and also sometimes it's very weak and wiggly, from 9 months of pregnancy, it becomes difficult. The web design becomes unstable. So we really need to tone it up by doing some controlled manner of Pilates exercises, such as pelvic curls, bridges, and leg lifts that we can target today. You're going to learn a lot of core strengthening, pelvic floor mindfulness, elevating a pelvis with the foam roller that we're going to, if you don't have a foam roller, you can always use a rolled towel up to 6-inch diameter. So if you can look at the diameter of my foam roller, this is 6 inches, and this will support the pelvic floor. Exercises such as plank, Pilates 100 and both pose can engage the core, but sometimes for absolute beginner, it could create more pressure. So you want to make sure there's no doming or coning on your abdominal muscles, especially if you have diastasis recti. Lastly, mind-body connection. So developing a strong mind-body connection is a crucial part for pelvic floor. So you're going to hear me a lot of verbal cueing from me. Like, I'm going to remind you to take a deep breath, expand your abdominal muscles, lateral rib cage flaring, and really mindfulness of squeezing, zip it up from your lower abs to your navel. So we're going to learn how to consciously relax them. Visualization exercises can help enhance this connection. So last keynote, is important to note that exercises for tight pelvic floor muscles should be tailored to your individual needs and limitations. So it is recommended to work with me or your local physical therapist, pelvic floor therapist who could guide you. And that's why I have my Revive Pelvic Floor Health Core Rehab, where I'm going to hold your hand, Zoom weekly calls to guide you safely and effectively if you're doing the exercises safely, even without me touching you. Because I have seen a lot of my online students getting better just doing my 8-week program. So let's begin the program. In seated position, we're going to start improving our upper back posture first, squeezing your upper back, lifting your hands up, open your knees out with your toes a little bit diagonal. As you breathe in, breathe out, spread it out, exhale. As you hold this visualization techniques, we're gonna expand your belly and then zip it up, squeeze your core in, and then lift one foot up on your right, and then down, and then inhale, switch to the other side. So it's like an isometric hold and then back center. So when you hold the back muscles, that's the lumbopelvic hip complex, it helps engage your upper back. As you open again, lift one leg up and down. So we're slowly challenging the balance of our core by lifting one foot at a time before we proceed. And then inhale, back center. Expand your belly, zip it up as you open and lift one foot at a time. Inhale, back center, open. And lift one foot up, and then the other. Last set, inhale, and exhale. And now we are proceeding with diagonal movement. This helps the PNF pattern. Squeeze your scapular muscles as you lift your right foot up, your heel up, and then back down center, and then switch. So same side, as you lift one arm up, you're lifting one foot up. Breathe in, breathe out. So this helps your oblique muscles and your core. It helps your balance, right, Sandy? Feels so good so far? Good. Breathe in, breathe out. And then you're gonna feel a little bit fatigue on your upper back muscles. As I said, your posture has a big impact on your pelvic floor muscles. Keep your head straight. Try not to tilt your head. And breathe in and breathe out. Last set. Well done. Now, as I said, we're going to do pelvic curls on the ball. So place your hand on your hips and we're going to curl. As you breathe in, lean forward a little bit. Inhale, exhale, squeeze the core, zip it up as you tilt back and forth. Expand your ribcage laterally, and then exhale up. Inhale, exhale. Squeeze your core in as you lean back. Good. You're gonna feel your pelvic floor really touching the ball. As you open your hips out further, it helps stretch your tight hip groin area. Breathe in, breathe out. Well done. Now we're gonna do circles. And this helps a lot of my patients, even pregnant women who wants to prevent pelvic floor issues as they prepare for their baby, to keep it strong and tight before the delivery and prevents any complications. So sitting on a ball is safe for pregnant women as long as you don't have a lot of restrictions from your doctor if you have very sensitive pregnancy with your approval from your OBGYN. 3 more. Take a deep breath, inhale, exhale. Last set. And then reverse circle. Feels good, right, Sandy? It's nice to cool down, especially if you lift weights and you need to cool down after heavy lifting. And when you lift heavy weights, sometimes when you're not bracing your core, it creates a downward pressure on your pelvic floor when you lift heavy, like deadlifts and stuff. So it's nice to do these exercises to balance it. So incorporate this on your, even once, a few times a week, 1 to 3 times a week. But if you can do it every day, of course, you'll see much better results. So now we're gonna extend one leg. I'm gonna extend one leg on your right. As you breathe in, you're gonna lean towards your left, lean with your elbow. As you breathe in and lift your arm up, exhale, and look up to the heavens. Extend your right knee as you lean on your left. So your right leg is extended, and stretch that hip groin opening. Breathe in, and then breathe out, switch to the other side. I'm extending my left, bending my right, leaning my right elbow, and extending my left arm, looking up to the heavens. Feel that stretch, right? It's nice to have the ball. Without the ball, sometimes it's too challenging just doing yoga and balancing. So it's nice for those postpartum or those women with perimenopausal, menopausal women with a lot of weakness on their hips. If you're sitting a lot, sedentary lifestyle with your work, if you're an IT, desk job, computer, it's nice to move your body, especially at the end of the day, and breathe out. Feels good, right? So we're engaging your postural muscles at the same time lengthening your pelvic floor. It's a combination of everything that we've been discussing for the past few days of my free 7-part video series. And lift your arm up, lean and pull, and look up to the heavens, and extend and reach. Can you feel the stretch on your hip groin? You feel that on your hip groin? It feels good, right? Good. Inhale, exhale, switch. Don't forget your breath work. Inhale, exhale. And you don't have to go all the way down. Lean on your elbow like this and just pull the top arm. There you go. Keep your wrist straight. Don't twist your wrist. There you go. Look up. Good. Stretch your neck muscles and then switch again. Inhale, exhale. Last set. Side to side lunge is one of the best ways to open that tightness. And then switch again to the other side. Well done. So this is one of my exercises inside my 8-week course that we're going to progress. This is just a sample, so you can start activating it right now before we further progress, especially if you have diastasis recti or umbilical hernia. So now we are going to lie down on our back with the foam roller. So this time we're going to place the foam roller underneath our pelvis. As we learned on video 2, gravity-assisted foam rolling is so good for those with downward pressure in our pelvic floor. So once you lie down, slowly lie down with your back on the floor. So my best recommendation is to lie down before placing the foam roller. Like this, you bridge up and place it. So far, so good. Are you comfortable now? If there's any increasing pain, it could be your SI joint. So my recommendation, if you have SI joint dysfunction, is to use an SI belt to protect that joint at the back of your sacrum and your iliacus. So my recommendation is to get a belt to support you if you feel so much pain. And as I said, you can use a rolled towel. Okay, we're gonna have the foam roller for our upper body, but you can also join me even without elastic band for those absolute beginners. So first, we're gonna take a deep breath through your nose. See, you can see I'm raising my abdominal muscles, and then lateral rib cage, I could feel the side of my ribs opening to the side instead of my shoulders lifting to my neck. I don't want that. It could cause neck pain. I want my shoulders really pressed down on the mat as I breathe in through my nose. And then as I exhale, zip it up from my lower abs to my navel. Tighten. Without moving your pelvis for now. I want that breath work really engaged to incorporate everything we've been learning for the past 2 videos. Inhale. Expand. Exhale, zip it up. So if you miss out my other 2 videos, please go back to video 1 where we learned breath work. And it's okay to go back again. Inhale, exhale, zip it up. And then video 2 is more about the foam roller that we did. Inhale, expand, Zip it up. Last set, breathe in and breathe out. So in video 2, I asked you to hold to the foam roller so it won't pop off and slide off. But for those who want to challenge today, you can hold on to the elastic band. And then as you breathe in through your nose, expand your belly, lift your hands up pointing to the heavens. With the elastic band, a little bit stretchy already. Expand your belly, inhale. As you zip it up, exhale, squeeze your core in, zip it up from your lower abs to your navel. And then slowly lift your right arm up overhead, just your right arm, and then your left arm towards your left hip. Diagonal movement, hold that position. And then lift off one foot up in tabletop position, 90-degree bend. Lift your right foot up, keep your knee bent to 90. Not too high with the leg extension, more like a bent position. And exhale, squeeze your core in. Breathe in, and then breathe out down. And then place your hands back to the starting position. And then inhale again. Exhale, zip it up, and then left arm up overhead, right arm down. Place your right arm towards your right hip. And then left foot up, tabletop, and breathe out. Bend your knee a little bit, 90 degrees. Toes pointing away like a ballerina. Bend your knees a little bit more. Lower your foot down a little bit. There you go. See, if you place a cup of coffee on top of your leg, you don't want it to spill. So make sure it's parallel to the ground. And then breathe in again. Inhale, expand your belly. Expand, expand. Inhale through your nose. Sandy. And then zip it up, exhale down. And then place your hands back to the starting position. We have 9 more to go. Inhale, expand your belly first. Take a deep breath. Exhale, switch to the right foot up. Toes pointing away. 90-degree bend. Slowing it down. We're not doing it too fast, right, Sandy? But we're holding it in control. Can you feel it on your hips? It feels good, right? Inhale. Expand your belly before slowly lowering it down, placing your hands back in the center and breathe out. Inhale. Exhale, switch. Breathe in and breathe out, back center. And then switch again to the right. Exhale as you lift and arm overhead, same side. Exhale, back center. Inhale, exhale, switch. Zip it up. Breathe in. Breathe out. You feel that on your shoulders too, right, Sandy? It's nice to strengthen them, right? Inhale, back down, last set. Exhale, switch. Well done. Now we are progressing by doing tabletop again. Breathe out. As you exhale, extend your leg, toes pointing to the heavens. And stretch. And breathe out. And then inhale, bend your knee and go all the way down to starting position and your arms forward again. And then switch to the left as you breathe out. Left arm overhead, left knee towards you. As you exhale, extend your left leg. Toes pointing to the heavens like a ballerina. Really curl your toes. When you curl your toes, you're really engaging your toe muscles. Inhale, bend your knee first before lowering it down. And your hands in the starting position again. Hands pointing to the heavens. And switch to the right. And then exhale, extend, toes pointing to the heavens. Really curl your toes. Beautiful. Inhale, back center. Bend your knee first before lowering it down. And then switch as you breathe out. Extend your left arm. Point your toes pointing to the heavens. Inhale, bend. And exhale down. 2 more to go, Sandy. Breathe out. And then extend. Inhale, bend before lowering your foot down and relaxing the band. And then switch to the other side. Last one on your left. And then extend. Inhale and down. Well done. How are you feeling? Is your arms getting tired? Your legs? So if you want, for beginners, We're gonna hug one knee to your chest. I'm gonna start hugging my left knee. As you breathe in, extend your right leg with your foot hovering a few inches off the mat. Can you balance without the foam roller moving? Good. Breathe in and then breathe out. Lift up, pointing to the heavens, and breathe out as high as you can. Toes pointing to the heavens. On your right foot. Higher, higher. And then once you reach up, you dorsiflex your ankle to feel the deep stretch. As you breathe in, exhale, slowly lower your foot down to the starting position. And once you reach down, you can rest your foot on the mat if you feel tired. Toes pointing away again. As you breathe in and breathe out, lift. Inhale, dorsiflex. Exhale, down. Inhale, toes pointing away. And lift. Toes pointing away. And then dorsiflex. And then down. 2 more. Inhale. Exhale up. Dorsiflex. And down. Last one. Inhale. And exhale up. And then we switch to the other side. So if you need to fix your foam roller, if it starts sliding off, make sure you reposition. Now hug your right knee to your chest. And starting position with your foot all the way down, hovering a few inches off the mat. As you breathe in, breathe out, lift. So we're targeting your hip flexors. And then dorsiflex, and then down. This is stronger, right, Sandy? I could see the difference. So we assessed Sandy's hip alignment last time on my back masterclass video. So you can check it out, my video 6. And this time, she's really applying what she needs to focus on, right, Sandy? Lift, toes pointing to the heavens, dorsiflex. You can see there's less tension there, right? So when there's less tension, it means that it's more balance your mind-body connection. So her right side has more disconnect. So her nervous system on your right side is a little bit off. So that's why the more we become more mindful, mind-body connection, the more you can fix your problem if you have pain on one side. Last set, breathe in and breathe out. Well done. How are you feeling, Sandy? Good job. Now we're going to do some butterfly stretch. You can readjust again. With your feet together, with your knees out. Lifting your feet up. Both of your feet hugging. There you go. Inhale, exhale, knees together. Breathe in, breathe out, open. So it's like butterfly wings on your knees. And then knees together. As you inhale, exhale, open. It's a lot more difficult for your right foot, right, to readjust. So this is a lot of mindfulness again, because with our pelvic floor, it starts on your foot. Mid-foot up helps support your pelvic floor. And it's nice to feel your toes again, right? Like really thinking about your toe position, your foot position. And then open your knees out as much as you can. As you inhale, feet together, exhale, open. 2 more to go. You're getting tired on your hips, right? It's a lot of butterfly movement. Last one. And from this position, hold on to the foam roller, Sandy. As you breathe in, hold on tight. And we're going to do slowly tap your feet with your feet together down to the floor as much as you can. And you feel some clicking on your hips, right? Just a little bit glide and stretch it out. We're going to cool down now by opening your knees out. And as I said, tight pelvic floor, you need to open it out like this. As you breathe in, breathe out. We're going to hold this in 5 deep breaths for relaxation. As we cool down. Making sure you really zip it up from your lower abs to your navel as you breathe out. So inhale, I'm expanding. Exhale, zip it up. 2 more deep breaths in. Mind-body awareness of really relaxing and letting go of that tightness away. Connecting to your pelvic floor. You can rub your hands on your lower abs to feel it. That's the basin of your pelvic floor as you breathe in. If you have C-section and you're cleared by the doctor, you can stretch and massage your C-section by doing some scar releases. I had 2 C-sections, so this is really tight for me. So it's nice to use the foam roller to open this area. Last deep breath in. And exhale, close your knees together and slowly roll off the foam roller and slowly get up. And that's it. I'm hoping you enjoyed my video 3 of one of my best kept secrets using the ball and the foam roller as well as the elastic band to build strength. I'm hoping you enjoyed my third video so far, and there's more videos coming up. So if you don't want to miss out my next 4 videos, write your name and email address down below so you can get direct access from me when I'm going to launch the video series. So you don't miss out on video 4, because video 4, I'm going to show you my comprehensive guide, my entire blueprint of my Revive Pelvic Floor Core Rehab, where I utilize core back immersion therapy to deep dive on your core and pelvic floor health. How are you feeling, Sandy? It's nice, right, to release them. And it looks so simple, but she actually lifts heavy weights in the gym. I'm impressed on her strength, but she's pleasantly surprised. The mindfulness of mind-body awareness is a different kind of strengthening, right? Yeah. And that's why if we don't incorporate this with just lift and high-impact activities, down the road, there's going to be a problem. So while you're still young and able-bodied, it's not too late. Even you're 70 years old right now, I have online students under 70s fix their bladder incontinence. And if you want to watch more, there's going to be more testimonies coming up soon from my online students that I'm going to interview who joined my Revive Pelvic Floor Health Core Rehab. And it's so exciting to see their lovely faces and finally find the solution after years of suffering. Years. Some of them are 15 years of suffering with pelvic pain during intimacy because of an accident on fractured hip. And finally, she's enjoying her intimacy with her husband of 15 years. I know, despite going to a pelvic floor therapist in South Africa. In 4 weeks. I know, and she's still doing some of my program, and she actually joined my back masterclass because she also has back pain, and she finally find relief on her back pain. It's so simple. We're not doing jumping jacks, right? But it's a lot of slowing down, right? It's a different kind of tired, right? Because we just worked out today, right? Before proceeding, this is our cool down. So our next training again is, you'll see Sandy more in my videos. So if you have any more time today, watch this video about video 1, learn how to proper breath work. I might give this to Sandy to learn more, because I noticed when she's breathing, she's not engaging much. And it's okay. That's why she's learning from me. And it's not too late to start. She has 4 babies. And then video 2 is where we use the gravity assisted to get more confidence on using this beautiful foam roller. And I'm going to launch my own foam roller soon. So be on the lookout on my launch of my new foam roller series. Until my next video training, always remember, be safe, be well, and healthy you. Bye. Thank you, Sandy.